Hello and welcome to this webinar today brought to you by the World Hepatitis Alliance. Today's topic is securing political will for hepatitis elimination in the context of UHC and also in the context of the COVID-19 crisis, which is gripping everyone around the world. And we're very happy to be joined by Unite today for this very important webinar, which is the global network of parliamentarians who are committed to achieving political impact towards ending infectious diseases as a global health threat. And they've been, they're great partners and collaborators with the World Hepatitis Alliance, and we're really thrilled that we were able to bring this webinar to you together. Just so you know that this is a pre-recorded webinar, so we're not live, but do please feel free to comment in the comment section below or tweet at us, and we'll try to respond to those as soon as we can. So I would just like to introduce first our first two distinguished speakers. So first is Ricardo Baptiste Leite, who is the founder and president of Unite, and also a member of the Portuguese National Parliament, and Victoria Grandsoult, who is Executive Director of Unite. So I'm going to hand over to Ricardo, that I think has a few words to welcome us today.
Well, thank you so much, Kerry, and it's a great pleasure to see Unite and the World Hepatitis Alliance working together once again. And it's good to see you, although virtually, as is the case with all of our fellow colleagues in this panel. Victoria, Unite's Executive Director, will have the opportunity to explain more in detail who we as a global network of parliamentarians are and what we do. I'd just like to say a few words regarding the moment we are living. To say that more than ever, we understand the power of community and civil society joining hands with politicians. Parliamentarians are, as we know, at the interface between the people that elect us and the executive power in each country. And we've seen with COVID-19, people coming out of their communities, joining hands. We've seen good come out of this, despite of the difficulties. And this is something we need to embrace and hopefully build on moving forward in the future. And as representatives in parliaments and senates and congresses around the world, we must keep governments accountable. We must make sure that the voice of the people, the needs of those that are in most vulnerable situations, are not forgotten. And those living with viral hepatitis are amongst those what we now call non-COVID patients, people living with the condition that in many cases is, as we know, capable of being eliminated. And we have been working on this along with the World Hepatitis Alliance, along with many other organizations in the field, and we cannot lose momentum. And so pushing for change takes 5 pillars. It takes politicians, it takes civil society, but it also takes the media, the scientific community, and the private sector. All 5 of us together can make a difference. And so I would like to end by saying that, and once again, thanking you all for watching this webinar, that many governments are now questioning if we can achieve the goals we had agreed upon before looking at the 2030 agenda. And the truth is, we must stay committed to those goals. The Sustainable Development Goals, now more than ever, should be the lighthouse to guide us in these times of trouble, to make sure that we don't leave anyone behind. And within those SDGs is the clear goal of combating hepatitis. And certainly together, we will be able to not lose focus while we end the pandemic. At the same time, we don't create a series of other health issues that we would need to deal with because their lives are truly at stake. So thank you once again, Kerry, and thank you, the World Hepatitis Alliance. It's always a pleasure to join forces, and I'll pass the floor to Victoria. Thank you.
All right, thank you so much. I will echo your sentiments, Ricardo. It is an honor to be here with you and Senator Cayetano and Honorable Esther Passari to speak on this important topic of collaboration between community and members of parliament to address the urgent need to eliminate hepatitis. And so if I may, I will just share a quick presentation to introduce who we are at Unite and our mission. And so Unite is a global network of parliamentarians who are committed to ending infectious diseases as a global health threat. It was founded in 2017 by Ricardo Baptiste Leite. It was his vision, and through the support of UNAIDS. And so we focus on eliminating communicable diseases as a global health threat. So we are all living with the social disruption of COVID and the coronavirus, but of course, many infectious diseases remain pervasive around the world and are affecting communities every day. And so we must not forget about these infectious diseases, especially viral hepatitis, which is the cause of death for millions every year and remains undetected by millions every year. And so Unite is a network of parliamentarians. Parliamentarians are in a unique position. They are at the interface with civil society, community organizations, and also government. They have access to up-to-date research, high-level information, and most importantly, they have power to change laws, they can allocate budgets, and all of this is critical for addressing these infectious diseases, achieving their elimination, and most importantly, staying on track for the Sustainable Development Goals by 2030. And so Unite was founded to address a gap in the global response to addressing these infectious diseases. Often when high-level decisions or key global health stakeholders are meeting to discuss the addressing of infectious diseases, policymakers and parliamentarians are not brought into the conversation despite their unique position and despite their access to power. So at Unite, we strive to ensure that the policymakers' perspective is at the table, is part of these decision-making processes and discussions. And we aim to inspire the members in our network to be leaders and champions for ending diseases in their countries through a peer-led network. And so we focus on all infectious diseases in addition to viral hepatitis. And we also focus on priority infectious disease areas, of course, sustainable development goals, drug policy, which is key for addressing hepatitis and HIV, and then, of course, outbreak preparedness and response. We are seeing now the devastation when there is not preventative measures made, when health systems are not properly budgeted, not reinforced, then infectious diseases can really have devastating consequences, especially for vulnerable communities and populations. And so we are truly a global network. We have 126 members in 60 countries. Although we are young, we are growing very quickly. And so we have divided the world into 10 chapters or 10 regions, and each region has an appointed chapter chair. We currently have 7 out of the 10 appointed, of which Ricardo is the president of the global board. And so our activities are in line with our 5 pillars, or what we call our theory of change. And this is how we achieve political impact as an organization. And so we seek to promote political accountability of all stakeholders. We want to raise political awareness that it is possible to end infectious diseases, increase political advocacy, mobilize our parliamentarians, and ensure political leadership to achieve the elimination of infectious diseases. We feel that we are a unique organization in this respect, that we are seeking to go beyond advocacy, beyond informing parliamentarians, but we really want to see political impact in the change of laws and the allocation of budgets so we can move forward the agenda of eliminating these diseases. And so the work of the network of parliamentarians is supported by the Secretariat. We are a team of 5 based in Lisbon. And so we support the activities of our MPs, but most importantly, we bridge the gap between members of parliament and key global health stakeholders. One of the most stakeholders, of course, being civil society and the community. Civil society and these NGOs that provide services, they know truly what are the needs of the populations that they serve and what are still the challenges and gaps to treatment and services that remain. So we really seek to bridge this gap and to be a collaborative network in bringing these issues forward to members of parliament. And so I'll just share a few events that we've had previously where we've brought together civil society partners and members of parliament. We've organized 2 policy days, both with a focus of addressing hepatitis elimination and addressing harm reduction. And so the first was in 2018. It was in Ricardo's hometown of Cascais. And that actually culminated in the signing of a call to action to address or to eliminate hepatitis in people that use drugs. The following year, we had a policy day preceding to the Harm Reduction International Conference in Porto. And again, this culminated in the signing of a call to action by 15 members of parliament from 13 countries to ensure that harm reduction is part of the 6th replenishment for the Global Fund. So always ensuring the hepatitis and harm reduction is at the forefront of our interactions with members of parliament. And then upcoming, we are organizing our first global summit for Unite's members. It will be on the 7th and 8th of September. It was intentionally or intended to be in Lisbon this year, but we made the decision to transition to a virtual platform. And so we will postpone until Lisbon 2021. And the aim of this event will be to bring together for the first time Unite members of parliament, key stakeholders and partners for networking opportunities to invigorate and inspire, to address these and eliminate these diseases, but also to align our strategy as an organization and our vision for the upcoming decade of delivery to ensure that we are urgently addressing the COVID pandemic, but that we stay on track and, as Ricardo said, see the SDGs as a lighthouse, that we do not fall off the course in ensuring that these diseases are addressed and eliminated. And so I will close by just sharing who our supporting funders are and who our collaborating partners are. Of course, Hepatitis Alliance is a close and long-standing partner of Unite, and our contact information. So we are a collaborative network. We seek to partner with all stakeholders in global health. And so we look forward to working together and continuing this fight together. So thank you so much for allowing me this opportunity. And I look forward to the discussion ahead.
That's excellent, Victoria. Thank you. And it's quite incredible that, you know, you guys do all of this with just 5 people. I mean, I think it's really quite staggering, really, all the things that you do. And I think our collaboration has had some really kind of fruitful results that maybe not everybody's aware of. So I thought maybe we could just talk about something that happened last year that was quite important, which was around the high-level meeting around universal health coverage, which was part of the UN General Assembly last year. So I don't know how familiar people are with these sorts of things, but basically high-level meetings are meetings where loads of the governments and civil society all come together to discuss a specific topic. So they've had them on tuberculosis and on HIV. So this one was on universal health coverage, which is like this global movement around, you know, not looking at just individual disease areas, but looking at really person-centered health and looking at the health of the whole person and not just specific things. So this is a big topic of conversation in global health, like at the World Health Organization level in UN. Like this is really the way things are being reorientated, and this is really the goal really for the next 10 years. So as part of these high-level meetings, there's a political declaration that all of the countries sign up to that lays out like some principles about wanting to achieve those goals in the future or in between high-level meetings. So it's really important, these documents, because it's what governments and it's what organizations can refer back to in the future about what should be included in these new UHC programs that happen. So at the Alliance, we were following this quite closely. And at the beginning, the document was very general, but as it kind of developed into the different stages of different drafts, there were more and more specific disease areas being mentioned. And these are drafted by a group of country representatives, not everyone at the UN, but a select group of countries. So we thought it was very important, because this is going to be such an important document going forward, that hepatitis should definitely be mentioned explicitly within it. So we organized a community letter of community organizations, and then we reached out to Unite as one of our key partners. And maybe Victoria, you can kind of tell the story of what happened from there.
Yes, thank you so much, Gary. Yeah, this was such an important and success for our organization and this achievement. And so last year, as this political declaration was just a draft to be signed at the high-level meeting in New York in September of 2019, you had reached out to us stating that, or bringing to our attention that in this political declaration, they were calling the attention the need to address infectious diseases as part of universal health coverage. They had included HIV, TB, malaria, but not hepatitis.
Exactly.
And how could we work together to ensure the inclusion of hepatitis into this important document to be signed later on in the fall? And so Georgia and Thailand were chairing the committee of drafting this declaration. And so we had our regional chair and member of parliament in Georgia, Honorable Miriam Joshi. And so we reached out to her and brought to her attention this omission of hepatitis into this declaration, and how we could work together to move forward and to see if there was a way to get in contact with the diplomats in Georgia working on this declaration. And so my recollection is we put you and Honorable Joshi in contact. And the rest is history, is success. So, we were successful in through your collaboration with Joshi and including the hepatitis in the declaration. It was signed on September 23rd, and so this is really important and to ensure that, you know, as you said, that when we are looking back on the importance of addressing these diseases, when we are looking, you know, how we are going to achieve universal health coverage, that all infectious diseases and hepatitis is one of the important ones. And so if you recall, also we had an event the day before, which was really a great collaboration as well, that we were able to achieve in the headquarters of UNAIDS. And so bringing together high-level partners, Honorable Joshi shared the story as well as yourself and Ricardo some words. And so it was really a great moment, and it showed that civil society, community can come together with members of parliament to really move the agenda forward and to achieve success on this topic. So.
Exactly, and it was just like such a great example of, you know, the community identifying, do you know what I mean, something that needs to be done, and the parliamentarians working in partnership to make that kind of change happen. Do you know what I mean, on the higher level? I mean, it was a really great achievement. I think it was terrific.
Yes.
And I mean,
so simple if you think about it. You know, you just link. You bring attention forward to the MP, they link with their colleagues, and you achieve success. So it shows that when you work together, you can go farther on this. So.
Absolutely, absolutely. So maybe that's a good point to bring in the rest of our panel, and we can explore this a little bit more in different parts of the world. Right, so I would like to welcome our new panel members here, and maybe we could just go around and everyone can introduce yourselves and just say a few words. So shall we start with Senator Pia Cayetano from the Philippines, please?
Hello, my name is Cayetano, and I am a senator from the Philippines. I chair the Senate Committee on SDGs, Innovation and Future Thinking, as well as the Committee on Ways and Means. But my interest in hepatitis is actually quite personal, as my father had hepatitis B and passed away when he was a senator.
Great, thank you. Chris, would you like to go next?
Hi, I'm Chris Munoz. I am from the Philippines, current advisor of Yellow Wire Society Philippines, former president of Yellow Wire Society Philippines, and current vice president of Philippine Alliance of Patient Organizations. I've been in this advocacy for, I think, more than 10 years already. Thank you.
Great. And Esther, please.
All right, my name is Esther Passari. I'm a member of parliament in Kenya, and it's an affirmative action seat. I represent issues to do with women, persons with disability, vulnerable minority groups.
Great, thank you. So, I mean, as we kind of talked about before, we're really kind of unprecedented times in terms of health and how health systems are evolving in this new world that we live in. And I guess the big question on everyone's minds in the hepatitis community is how can we ensure that hepatitis isn't left behind, that hepatitis patients are still looked after. So maybe Esther, if we could start with you about how do you see health systems evolving, and how do you see the role of civil society in what's currently happening in health?
Okay, I forgot to mention I'm also a member of the health committee, and at the moment, I mean, with this COVID pandemic, I think the only conversations that are happening, of course, are to do with COVID. I mean, Kenya's the cases, the numbers that we're having in Kenya on the increase. Civil society has been engaging us mostly on domestic violence, because we've seen a spike in domestic violence, defilement, rape cases during this pandemic period with the lockdowns and everything. I feel that we have budgeted for TB, hepatitis, drug abuse, but unfortunately, we've also seen the Global Fund reducing its budgets on budgetary support to Kenya. So that of course means that we will have to have local interventions, and civil society are active in terms of trying to keep the government on check. But at the end of the day, I think to combat all this, it's not just civil society giving us the data and the figures, it's also government recognizing that we need to play a big role. We've neglected most of these causes like TB, hepatitis. Most of them have been donor funded, but now that donor funding is shrinking, we need ourselves to put some money in it. So civil society has to continuously engage government, but civil society's voice right now is strictly on, the pandemic and the rate of abuse, domestic gender violence, etc.
Yeah, it's a very wide picture. I mean, the impact just goes across everything, right? And Ricardo, I mean, you're involved in, obviously you lead Unite, but you're also involved in things like the G20 and the World Bank. On a lot of these new international structures are incorporating civil society, or civil society engagement with them is become a priority for them. Could you tell us something from those different points of views that you have about, what happens, how we move forward and how civil society can be involved in that?
Well, Kerry, the truth is, I think that once again, if something good comes out of this crisis, is a clear acknowledgement that in a way we were not prepared for such global threats. And so, especially when it comes to global public health emergencies, and there is a growing consensus that there is a need for us to do more. And doing more, also, I think the consensus is growing that it has to be built also from grassroots, community-based organizations, or at least they need to be included in these processes. And moving forward, there is tremendous, I would actually use the word fear from these organizations in terms of the social and economic cataclysm that is in the making. If this were a tsunami, we are currently at the stage where the wave is still building. And so looking forward to the years to come, and especially the next 6 to 12 months, there's tremendous concern of how to respond. And we know from past crises that those that are most vulnerable, or at least those that are in most vulnerable situations, are the ones that will tend to suffer the most. And so it becomes clear, and there is an importance for multilateral organizations such as the G20, but also the World Bank, the IMF, to come together and to organize themselves in a way that they are responding not only to the needs that are expressed by governments, but also to the needs that are incompatible to the needs that are seen on the ground. And it is bringing those two worlds together that are not always coincidental, that we need to work harder. And this to say that more than ever, multilateralism is important, because we see that COVID-19 is imposing an insular view, and a tendency for isolation of countries, wanting to keep others out and protecting those within. And we know that viruses and other global health threats know no borders. This is a fallacy that many are falling, it's a trap that many are falling into that we need to overcome. This is actually a moment where nation states need to come together through multilateral organizations and organize global preparedness and responses. And that is something that I think has not been done yet. But moving forward, I think that it is an inevitable act. And what we have learned is we need to do that, not only with civil society, but civil society has to play a very important part. I would also include other partners beyond public state, but also the social and private sectors, or else we will not be able to achieve the Sustainable Development Goals, and people will be left behind if we don't work harder together.
Absolutely. And Pia, how do you see this developing in the Philippines?
Well, like many countries, we were caught unprepared, but there is a realization that we must take advantage of this scenario and learn from it and move forward. Our region, Southeast Asia in particular, but Asia in general, have been, it has been mentioned and pointed out that a lot of countries did quite well in managing the pandemic. And if you look at those countries or areas like Hong Kong, Korea, Taiwan, they learned their lesson from SARS. So if you can't prevent, or if you can't do your best in preparing for this kind of thing, then the least you can do is learn from it and do better, which is what these countries have shown. So in the Philippines, I actually sponsored the measure that gave the president the power to respond to COVID in early March when we had a lockdown, to release funding and to support the healthcare services and so on and so forth. And one of our key points there, at least the health advocates, was to ensure that the health systems continued to cope and that the direction doesn't all go towards COVID, because all these other sicknesses and health conditions continue to persist. So that knowledge is there, but as to the reality on the ground, if we're able to really take care of it, I mean, there was so much restrictions by way of the lockdown that obviously there was a lot of services that were not delivered. And again, the most vulnerable, these are people with underlying conditions. These are people with, you know, by the nature of their sector, whether they are persons with disabilities, women and children, those living in poverty, all of these people had a lot, sacrificed quite a bit. And so now's the time that we're trying to rebuild, but the virus is still there, so it's still difficult.
Absolutely. And maybe Chris, we could tell us a little bit about what it's like from the other side of this equation as an advocacy organization for hepatitis at this time.
Well, from what happened with the COVID is, I think it's the first time that I saw many policies that came out from the Ministry of Health and other sectors as well. So what I saw is sometimes policies don't work well if it's not co-created by civil society, or let's say if you are going to do a policy on transportation, then you don't include the transport sector. So sometimes, because since they're in the receiving end, or whoever is in the receiving end, sometimes tend to not to agree. So in the end, sometimes you experience troubles in implementing, because policy making is one thing, but implementing is another thing. So that's what I saw, that I think it's very important that civil society or many sectors get involved in policy making from the start. So at least if we all agree to a policy, I think it would be easier to be implemented.
Absolutely. And it's really about how, I think, you know, we're all working towards the same goal, right, for the health of our affected communities. So it's really about how do we make those kind of meaningful and positive connections between civil society and politicians and decision makers, you know, to make that synergy between, you know, even stronger. I don't know, Victoria, do you have any like views about you know, making that happen? Obviously, you guys are, you know, very active in hepatitis, but also looking at, you know, a wider picture as well about that, you know, the importance of that partnership between civil society and policymakers.
Yeah, I would say that the partnership is critical. I mean, the organizations working with the community, the civil society, they are the ones that truly know what are the needs on the ground, and they know what is missing in regards to policy funding in order to properly address the infectious diseases. And so, unfortunately, what, you know, our organization Unite is able to provide this bridge between civil society organizations and the members of parliament, either in our network or around. But, you know, not all civil societies have this link. You know, we hear often that they do not know how to get in touch with members of parliament, and they're not sure how to arrange these meetings and how to get their needs across. And so this is something we work actively to do. And we just know that it must be fostered in order to have an appropriate response to eliminating these infectious diseases. And especially now with the COVID, and as you know, Pia and Ricardo have been saying that unfortunately the resources are now being diverted, but limited resources that there were are now being diverted to this response. And so had the needs of the community been addressed always from the beginning, had health systems been robust, had their resources been and their needs been met, then we wouldn't perhaps be having such a fragile response now. And so I would say it's a critical partnership.
Absolutely. And it's, you know, we have 300 members, you know, around the world in over 100 countries. And they all, you know, they're all very focused on the needs of their community. So a lot of them have, you know, refocused their efforts to help address issues around COVID, as well as doing other things to serve their communities, like delivering medicines where there's been stay-at-home orders and all of these other things. So, I mean, as policymakers, as members of parliament, at this time of kind of competing priorities, and now looking kind of going forward where health budgets are going to be under, you know, a lot of stress and strain, and, you know, in many, there's been many instances, you know, when budget cuts have to be made, that, you know, hepatitis programs are often the ones that are reduced. So how can civil society positively engage with policymakers by you know, still caring for their communities and the needs of COVID, but also not wanting people living with hepatitis to be left behind? So what would be your recommendation about how to effectively engage at this time? Esther, maybe would you like to start? Or Esther, are you there? Unfortunately, it looks like that we've lost connection with Esther, but hopefully that we can reestablish that connection. But let's just continue. Yeah. So the question is, how can hepatitis organizations be the advocates for hepatitis that they really want to be at this time that we also want to be, you know, be aware of the other needs that people have?
Yeah. Well, from my experience, connections that I have made as a member of parliament with civil society and organization have continued to stay. So we stay in touch, and you know, we with technology, we send text messages to each other, barely even emails. Philippines is text capital of the world. So that allows us to stay connected and check with how that particular sector is going. So obviously there was a shift. There was like a 180-degree shift on COVID. But soon after that, the concerns of different sectors would come out. Like, for example, when you speak of a lockdown on transportation, the needs of patients to get to their healthcare facility is something that had to come up. So my brother happens to be the mayor of our city, and what they did is they hired the local transportation, their jeepneys, they're like small buses, very peculiar to the Philippines, that would ferry these patients to the hospital. So this kind of long-term relationship does help you tide difficult times and just makes you more productive regardless of the situation. So that's what I would recommend. I mean, for those in areas that don't have these, where organizations don't have, you can have a champion. Like in my case, my father had hepatitis B and he had a liver transplant. My brother, the mayor that I referred to, gave 2/3 of his liver to my dad. So obviously anyone who calls me about hepatitis B or liver cancer has the whole attention of my family. You can't separate me as the person, as a daughter, from me, the lawmaker and legislator. I will automatically stop whatever I'm doing to reach out to these kind of people. But I mean, that goes for my personal story with hepatitis B, but I have other stories that, humanize me, and it's not just about being, pursuing, a particular agenda. So that's what I would really recommend, because when you have that relationship, your agenda gets bumped up in the agenda of the policymakers you're working with. Because if I have 100 things to do, but I know the personal stories of this particular advocacy group, then I'm only human. I'm affected by those stories and I want to do something about it. So that's my recommendation. It shouldn't be one thing at a time. And case in point, just before COVID, and then we continued to discuss it right after, I was in touch with a longtime friend. She's a hepatologist, and she just sends me messages and official invitations by text message to the next agenda of the Hepatology Society on addressing discrimination against persons with hepatitis B in the Philippines, because a lot of them get screened and then they can't get jobs. So with that kind of relationship, she doesn't have to wait in line for 3 months to see me, which sadly some other people do, not because I don't want to see them, but that's how long the list is.
Absolutely. And I mean, that does also kind of go to the heart of the whole UHC issue in terms of, communicable diseases or diseases that normally have had these very big, dedicated programs. And how do we move from those big dedicated programs into a more integrated approach in which that different, that we're looking at the whole person, very person-centered health. So I guess the question is, how do we move from these vertical programs into this kind of integrated programs? And if you're an advocate for one particular one, how do you bring those messages to policymakers effectively?
I'm happy to jump in here to say that looking at, first infectious diseases, but then global health at large, it has become clear throughout the years, even before COVID, that a verticalized approach had some problems with it because we were losing opportunities. The cost opportunities of doing a vertical approach were tremendous. And if we think about it, the synergies we can find when we work on drug policy, for example, looking at viral hepatitis at the same time as we're looking at HIV and other bloodborne infections, for example, if we integrate that with mental health, for example, the list goes on, and it shows that one single approach can have multiple ripple effects. And so more and more, I think this goes to show that we need very strong scientific evidence to guide our decisions as policymakers. And we need very, very strong technical leaders in the field to support the policy and political decisions, and that we need to work closer together. I feel that moving forward, the people will demand more and more that decisions be made based on concrete evidence, and because people understand how poor decisions actually will have a negative repercussion on their own lives. And if we start to have a more holistic approach, looking at the challenges at large, instead of just looking each of us in our own silo, we tend to be much more impactful and successful. And so I think that is another learning that, or lesson that we had from pre-COVID that has been reinforced with this crisis.
Great, thank you.
I'd like to add also, Carrie, I don't know how many parliaments have a committee similar to the committee that we just formed in the Senate, the SDG, Innovation and Futures Thinking. And that was an initiative that I took because I used to chair the Committee on Health, and I realized that there were so many overlapping agencies that weren't talking to each other. And as a chair of the Committee on Health, my jurisdiction was limited. So and then internationally, I worked a lot on the MDGs, which later on became the SDGs through the Interparliamentary Union. And I felt the need for such a committee. So we have this now in the Senate, and there's a similar committee in the House of Representatives in the Philippines as well. So this then creates that opportunity or that platform for us to discuss, you know, multi-layered issues. And if you take note that it's the SDGs, Innovation and Futures Thinking, and so it also forces me to think beyond the now and look at, you know, what are the innovations out there. I'm not a doctor. Very few have the credentials of Ricardo, who happens to be a doctor and gets elected to Parliament as well. But most of us are just one or the other. So I get the chance to bring in experts who can educate us about this and you know, expand our way of thinking so that we can really look into different kinds of futures and how we can prepare for this. What are the innovations out there? How do we move from where we are now to where we want to be 10 or 20 years from now? So, and then you have a lot of people in civil society who have different interests in that. There may be people not interested in hepatitis per se, but they're scientists, they're innovators, or they're technical people and they want to deliver healthcare via digital, whatever it is. Then you have all these different people, you know, coming together. So that's why I'm excited about the committee, and I hope that there are more parliaments who have this kind of platform.
And Chris, maybe we can just talk about a little bit the community perspective in your experience of, you know, advocating to decision makers, and also what it, you know, and at this time, not just with COVID, but of UHC and how, you know, we're looking at how hepatitis community organizations fit into this wider view of health. You know, how you're sort of navigating this current situation that we're in.
Well, so I like to say to my Senator Pia Cayetano, I always forget. I've been wanting to be here earlier. So actually, if I don't know if Senator Pia still remembers me. I think we met in the National Viral Hepatitis Task Force when it was first launched. But you know, in policy making, sometimes it depends on what I see in 10 years. So let's say, let me just say, let's say 2 programs. One, we're talking about a discrimination bill, anti-discrimination. Next one is we're talking about implementation of hepatitis B treatment program. Okay, so one bill costs you really, I don't know if it has a cost for the anti-discrimination, but for the implementation of hepatitis B treatment that is ongoing in the Philippines right now, so that has a cost, right? So it's 2 ways for the policy. One is the willpower, and 2, the budget, of course. So for the implementation for Hep B, it's more on money matters, the budget. Well, how much will you allocate? Because the Philippines started its program since last year, but it's only it's not a Ministry of Health. It's a Ministry of Health program, but it's only a pilot project. So I'm really not sure if it will continue after the, let's say, 1-year run of the implementation. So in this policy, what did I see? So normally, the Ministry of Health is should be the overall, right, in the whole country. But we see that not all local governments want to take in to have a program. And I hope Senator Pia can advocate for a fixed policy that would integrate the hepatitis B program as a permanent program, Ministry of Health program that would also be integrated in the UHC, right? So if we want integration in the UHC, let's say one is to the maternal and child transmission. We can start, that's one avenue. We do screening for the pregnant women. And then of course, after that, it's the vaccination. So for vaccination, it's free in the Philippines. So two, we go to the barangay level. It's a community. So we can start screening from there. And after that, what is important is not only the screening, because in the Philippines, you can get free screening when you apply for a job. In fact, employers screen you if you have Hep B, and of course, you're getting denied. So that's another topic. So let's say if you want to integrate the viral hepatitis to the universal healthcare, start with the community, and ensure that after that, there will be free diagnosis and free treatment, right? Because let's say if you just want to test, keep on testing, but you don't have a program until treatment, then that's a problem. So what I saw is the cost. You see, the screening kit is a little bit low cost already, but you still need to be tested for, let's say, five kinds, especially the viral load, which costs a lot. So the diagnostics are very much expensive. So before you get the treatment, so let's say the whole the kit only costs 100 pesos, so that's $2. Then you have the diagnostic kit, the diagnosis, when you run the blood test, that costs more than that. That costs, I think, around $20. And of course, the treatment itself, it should be maintained since it's lifelong treatment. So that's a program for the hepatitis B. So let's go to the anti-discrimination. It doesn't cost a lot, right? It has no cost. You just have to implement it. From what I saw, so because we were really, what we want is, even though if we had an advisory already, we want a bill, a formal, let's say a law, because advisory is not really a law. It's only an advisory. But thanks to Pia, we filed a case, I think 3 years ago, because not everybody wants to undergo a labor case. You know, when you file a labor case, you don't win it by a year. It took us around, I think, more than 3 years just to get one decision. The first decision we lost. We refiled it last year. And the second decision came out, it was overturned and we won. And one of the major factors actually why we won is because of the guideline for the implementation of the workplace policy. So that was one of the main factors of the judge to consider it. But if you will look at it, if you have a law that is very explicit, you know, the judge cannot say anything. If you will read what the first judge says, why he considered that it was not an illegal termination. And in fact, he was saying that hepatitis B can be transmitted. And since the worker has already been infected in 8 years and it is still present in the worker. So it is legal to terminate him. So, you know, the interpretation is different. You know, you have one judge reading this kind, you have one judge reading it another kind. So I don't know if we're done, but we're going to have, if he wants to rebuttal, the employer wants to rebuttal, so it's another thing. So, you know, how fast does policy work? You see, last year we had we had a hard time really finding a bill getting passed. But in Davao, the LGU, the local government, passed a bill within 3 months, an anti-discrimination bill. It was not very specific for viral hepatitis, but the mayor was advocating for that kind. So because of her strong voice, the employers most of the employers do not test the employees anymore. So, that's the kind of, in the policy making, there are pros and cons, and maybe one of the advice I can give to civil society is be ready. When you see the window, because I understand, Senator Pia, there are lots of things to do. It's not only on viral hepatitis and STI, you have HIV, you have transport sector, you have the mental health law, but when you see the opportunity, you have to be ready. You just can't wait and wait. You have to jump in when the ship is there. You have to jump in and, be ready to go on with your battle. Thank you.
That's really great advice. And that kind of really ties into something that we're doing around World Hepatitis Day, in that we've created a community letter that will be sent to every ministry of health around the world, asking for the governments to honor their commitment to the 2030 hepatitis elimination goals. So this was something that we created for, not only as something globally for the Alliance, but something for individual organizations within their countries to use as an advocacy tool, as a way to start a conversation. So maybe we could just go around and say, just everyone could give their best piece of advice on how civil society organizations can, maybe use something like this letter to engage decision makers, whether that be on a national or a local level. So what would be your best piece of advice if there's a community organization that really wants to, have a conversation to engage with a policymaker? What would your best advice for them to get started?
Well, if you check the background of their policymakers, whether they are local policymakers or national, you should be able to find, the person that would best connect with your agenda. So, like in my case, I ran on a platform of healthcare, and my father had just died. He was a senator in office, so everybody knew that. So it was easy for us to gravitate towards each other. I was looking for advocates who believed in what I also wanted to do, and these advocates were happy that there was somebody like me who would be in public office. But that's my first point. Look at the backgrounds and see who has a common agenda as you do. But don't hesitate. It could be local, it could be national, it could be both, because you never know. All you need is that one opportunity. And if you have a city, as Chris mentioned, there's Taguig City. That's the city where my brother is mayor of. If you just have one city and the local news picks it up, or other mayors hear of it, other governors hear of it, then it could spiral, and your local ordinance could become a national policy. So I would say don't hesitate to go wherever your voice could be heard and where it can be duplicated and magnified.
Excellent. Victoria, what's your best piece of advice?
Yes, I would certainly build on Senator Pia, what she said, that I think, not to be afraid to approach your members of parliament, certainly looking at their background. There's health committees, or as was shared, there are committees on hepatitis, on other infectious diseases, and to hold your governments accountable. A letter like this can be powerful. This is something your city, your government committed to, and ensure that they are sticking to it. And whether you have to find creative means with social media or video or an event, I think to not be afraid and to go for it. And I think you'll be surprised at the response that you get. You have many champions within parliaments who are looking for your call. So to go for it.
Excellent.
Okay.
No, Chris?
Yeah, okay. So I think one thing that I realized in these years of advocacy is, I think even if you're the president, you cannot, it does not mean you're the one who should be pushing on what you want. In my experience, the last strategy that we have done is, since, Philippines is an inter-island. So we form groups. So let's say cities, you have a group of people who live there. So we have those communities, those in the communities go to their local LGUs, go to their policymakers. So I think what I saw, it's more powerful because it's their constituents. You know, it's the people who place them in their seat, right? So that's one thing that's number one. So maybe community, well, let's say in the US, if you have a governor, if you know, those people who elected him will be the one pushing instead of you who lives far away in another city would be much better in a position to push for it. So another is, it also doesn't mean that you have to take your advocacy alone, you know? So like me, we work with WHO, we work with you, WHA, we work with the doctors. So we work with people who also have interest. You know, we don't compete. Our organization does not compete. If we see an organization is aligned in our goals, so automatically we send them a message. We want to know one another because, you know, it might not be us who can push. It might be them who can push because they have greater influence than us, right? So it really depends. The point is you should work together with everybody. It doesn't mean that, you know, they have to be a hepatitis patient. You know, right now, 10 years before, we always advocate that the Yellow Warriors should be a patient-led group, right? So now we change. So we say we add patients and advocates. So it doesn't mean that you have to have hepatitis. You only have to be an advocate, then you're be part of the group and we can together push. So that is a multiplier effect. That's all. Thank you.
Excellent, thank you. Well, we're coming to the end of our time. So maybe Ricardo, you could just like take us out on your thoughts on, you know, and your advice for civil society organizations that really want to create a meaningful relationship with policymakers.
Well, I think everyone really chipped in with great ideas. I just add by saying that these kind of international letters or documents or frameworks that have been approved by multiple countries are sometimes a greeting card and a great way to get one through the door to speak with a representative or a minister or a member of a parliament or a Congress or a Senate. And I would leave 4 tips, if I may, just for people advocating for issues, trying to meet what politicians are looking for in the meeting and trying to be as objective as one can. I think Pia was very clear, doing the homework of understanding who you're meeting and what are their interests so that you can know which buttons to press is extremely important. Another issue in looking at the four recommendations is one that people should, the proposal that whenever a civil society organization presents to a politician, it should be in line with public concern. Most politicians want to serve the people, want to serve the people's interests. And if there is no public concern on an issue, if there is no awareness on this issue, it is very difficult sometimes to get the politicians on board. So if that public concern, if that awareness is not there, work on that as part of your homework to make sure that when you reach the politician you're meeting, he or she is already sensitized in a way to the issue from his or her constituents. The other issue, the second recommendation is to present clear before and after data. Many times we look at what will happen if we do what we do propose. Many times we forget to say what will happen if we do not do what we propose. And that is very much the reality when it comes to viral hepatitis. People tend to look only at what will happen if we do start, for example, if we do an effort to try to eliminate hepatitis C. Nobody stops and looks at the data. What will happen if we don't do anything and continue business as usual with tremendous rise of costs? That leads to the third recommendation is, when making a proposal, make sure that it's something that is realistic within the current budget. And so if it's something that is extremely expensive and is not compatible with current resources, break it down. Present a solution that whoever you are meeting can actually apply it in the real world. And if that can lead to savings in the short term, fantastic. If it's budgetary, from a budgetary perspective, neutral, great. If it does imply a rise of costs, try to present where that money is coming from. Be realistic and present real world solutions so that people dealing with you know you're serious and they can present this as a real solution to their partners. And lastly, we need to focus on presenting timely results. This means that, you know, from a public health perspective, many times we say, listen, this is going to be fantastic 50 years from now. That is not compatible to the election cycle. We need to find ways to make those long-term results compatible with the short-term results of policy and of politics. And to do that, many times we need to break down the long-term results into smaller semester or yearly or biannual results, so that whoever is making the decision can have something to show for, which of course is extremely important. I think if we are capable of applying these different tips and adapting our message in a proper way, we can convince those that are in power. From my experience right now as president of Unite, a global network of parliamentarians, most people working in the public field want to serve for the greater good. And I think that is something that we all need to embrace. Politics as a noble service for the people, to the people, with the people. And that is something that hopefully we can also do better together between Unite and the World Hepatitis Alliance, along with the rest of civil society out there. Thank you.
Thank you so much. It's incredibly useful advice. And I'd just like to thank you and everyone that was part of this webinar today. It was such a useful session, I think, and I learned a lot, and hopefully the people watching will do as well. So I just want to say thank you all very much. And I look forward to working with you all in the future. Thank you.
Thank you.
Bye-bye.
Thank you for joining this webinar, which is part of our World Hepatitis Day 2020 series. To find out more about other webinars in the series, visit worldhepatitisalliance.org, where they'll have details of all of them and you can watch them on demand. So thanks once again and see you next time.